untreated heartburn or acid reflux can lead to cancer, which is pretty crazy. If you want a way to force your body to permanently stop acid reflux and heartburn in 48 hours, click the link in the description below. For now, let's get to today's question.
The question: what is acid reflux and what is its effect on the heart? Answer by Rory Malone. The stomach has a protective lining that resists damage by the acid. The thick cells that line the stomach secrete large amounts of protective mucus, so the acid produced does not irritate the stomach. The esophagus does not have this protection. Video: heartburn no more. TM: normally, a ring of muscle at the bottom of the esophagus, called the lower esophageal sphincter, LES, prevents acid reflux. This muscle acts like a drawstring that opens or closes off the opening between the esophagus and stomach. It is supposed to close tightly between bites and when you are not eating. Gastroesophageal reflux disease affects 20% of Americans to some degree at least once a month. Some adults experience GERD weekly or daily. Not just adults are affected, even infants and children can have GERD. Answer by Sarkonanaidu. Acid reflux, or the medical term esophageal reflux disease, GERD, is a medical condition where your lower esophageal sphincter, which is like a valve at the end of the tube where your food goes in, fails to contract properly, allowing acid from your stomach to come up through your esophagus and cause irritation. It is a common condition and the risk factors include consuming caffeinated beverages, stress, smoking, binge eating just before bed, and etc. You might get a sour taste in the mouth when you wake up called the acid brash. In severe cases, the acid can corrode the inner lining of the esophagus and cause ulceration, which would lead you to having difficulty in swallowing and painful swallowing. The best way to solve this is to go to the doctor. A 24-hour pH study or manometry will be done to evaluate the strength of your lower esophageal sphincter. An endoscope also will be done, in chronic cases, to rule out hiatus hernia and Barrett's esophagus. Barrett's esophagus could later develop to become cancerous. There are certain medications that can be used to reduce the acid secretion in the stomach, which are proton pump inhibitors like omeprazole and esomeprazole. Your doctor might also prescribe H2 receptor antagonists like ranitidine, but evidence has shown that PPI has better efficacy compared to H2 raw. There are medications to protect the mucosal layer of the stomach and esophagus like Gaviscon and alginate and also sucralfate. If medication doesn't work, then the surgical option is to perform surgery. Although acid reflux has nothing to do with the heart, the acid that travels up the esophagus could sometimes cause discomfort and burning pain just directly behind the breastbone. That is called a heartburn and is a common differential diagnosis for anyone that comes in with chest pain. Answer by Martha Kirtley. Acid reflux is acidic stomach content backing up through the lower esophageal sphincter, the valve at the bottom of your food pipe, at the top of the stomach, into the esophagus. The tissues of the esophagus aren't physically appropriate to be touched by the stomach acid, and can be chemically burned or scarred by the acid. There is absolutely no connection to the heart. The feeling of the acid gives a burning sensation, and because the esophagus is in the center of the chest, the feeling is commonly called heartburn. Acid reflux that goes on for many years may lead to cancer of the esophagus, but it has no impact on the heart.